Here at noon Eastern. We are going to wait just another minute or two to allow folks to trickle in. And then we will begin with our host today, Mr. Scott Holdsworth, who will introduce himself in just a moment. In the meantime, if you please could ensure that your full name is listed so we can follow up with a recording of today's webinar. And your name being listed allows us to take attendance and send you the recording of this webinar as a follow-up. We certainly encourage you all to ask questions or leave comments in our chat box at the bottom right. You should see a little kind of speaking thought bubble. Go ahead and click that and you can send a message there, and we will address those as time allows at the end of this session. And again, we'll wait just 1 or 2 more minutes to let folks trickle in. We will then, this presentation, as I said, is being recorded, and we will get started in just a moment.
Michael, am I advancing or is Rachel going to advance?
We will advance the slides for you.
Fantastic.
Okay, we are 2 minutes past noon. With that, we are going to get started. And please, Mr. Holdsworth, take it away.
Well, good afternoon, officially, everyone. Welcome to our webinar today about breaking into the exciting world of medical device sales. My name, as Michael said, is Scott Holdsworth. This is actually my 5-year anniversary today as we speak with Medical Sales College. So I've been privileged to be a part of the organization during some what I would call rapid growth. And so it's my privilege to be able also to talk to you about my experiences and then what you might be able to expect about this wonderful opportunity that could be in front of you. So 35 plus years in the industry, almost 20 with Zimmer, which you may know as Zimmer Biomet now, and then about 15 with Smith & Nephew. At Smith & Nephew, one of my last roles was sales training, director of sales training for the Americas for both hip, knee, trauma, and robotics at that point in time. And as I said, I joined here in May of 2020. So I have also been the campus director for our Atlanta location, so I can speak to that experience. So I'm formally an instructor with the organization. I'm coming to you this morning live from the wonderful city of Memphis, Tennessee, which is my current home base. So go ahead, next slide, Michael. So this can certainly pay off for you. I will also speak to you from the perspective of a father whose son got into this business. So I bring a little bit of that to the table. So we're going to talk about what the career is and where really maybe what defines medical device a little bit in case you're not really sure about that. How to leverage those transferable skills that you have, things that maybe you don't think about that actually make you a pretty decent candidate, all right, inspiring some confidence. What MSC can do to fill some resume gaps. I have seen many cases of individuals both with and without bachelor's degrees make successful transitions into this business. All right. And so know that on the front side, and then we'll have a little time at the end for some Q&A. So I want you to think about this as a little bit of a three-legged stool. From a personal standpoint, I can tell you it's been very rewarding for me to be able to literally travel the globe as part of this exciting area and utilize some of the skills that I learned in college. I have a Bachelor of Science in Business Administration. I do not have my master's degree. I family and other things just kind of got in the way of me going back to do higher education. But from a personal standpoint and confidence wise, it is such a great area to be in. Not to mention the professional aspect of it. When you have that opportunity to be in an operating room with a very highly trained and highly educated and highly experienced surgeon, and at the end of the case, that individual turns around and says, "Hey, Scott, thanks for being here. This patient's going to get a great result, and some of that's because you were in the room." Okay. From a professional standpoint, that's probably the highest of the highs for me, that you would be considered an active and important and critical part of that team. So professionally, you are going to be interacting and communicating with highly trained, highly educated people. This is one area of sales where most likely you will never be as smart as your customer. All right. This is not retail where you can come talk about a pair of jeans. This is talking about permanent implantation in the human body, for instance, by surgeons that have 9, 10, 11 years of formal education beyond undergrad. Okay. But the cool thing is you can be as smart as they are about your product. Okay. And then certainly financial. It is an industry where you can make a large sum of money. Now, there's a 4-letter word that I think if you're going to be successful, you should implement this into your vernacular. And that word is simply grit. That is what hiring managers are looking for when they call me and say, "Hey, Scott, who do you have that's got grit?" Which means unparalleled work ethic, responsibility, accountability. Will literally just simply get out of bed every morning and do what they say they're going to do. Because if you can do those basics consistently, year over year over year, the financial rewards are outstanding. So you can support a family, for instance, and in some ways, depending upon your employment status, you can set your own hours even, which I think has a lot of work-life balance desire for many candidates. But please, please, please do not go into this thinking this is an industry that is all about work-life balance. It is all about work to start. Please know that. Okay, next slide. So I am what they call a relationship seller. I am not necessarily a technical seller. I'm all about getting to know my audience, and we will teach you some of those things about the ability to develop relationships as you conduct your calls. Most of the conversations you will have with a surgeon, for instance, they are all relationship in nature. Until you get to a certain point. What we talk about is once they finally know your name without a name badge, but simply as, "Oh, that's Scott Holdsworth with XYZ company," then you can start speaking about your product. But probably 85% of your conversations are getting to know someone. All right. And so that's really, really important. All right, is getting in front of them on a consistent basis and getting them to know who you are as a person. That is one of the things they desire, because if they're going to trust you, which is the number one thing you have to develop, is trust. That's why if you look at the slide, you see the two people standing there with a red hat on. Okay, that is the sign of a medical sales device rep in the operating room. The red hat, so that everybody in the room knows who the salesperson is. But it's also an important part of the job. And probably the majority of your first few years in the industry is really based upon that, what we call case support. You're in the room helping them get through the surgical procedure in a very economical time frame. Remember, it's all about the patient on the table. If you think about that person as your grandmother, your grandfather, for instance, they will always get the pinnacle of care from you. All right. And so as long as we are perceived as an asset, then they want us in the room, or we've earned the right to be in the room. And then if you demonstrate that consistency and that grit, they're going to want you in there, and then you will be considered a valuable piece of the team. All right. Next slide. And one of the things that last slide mentioned, early in your career, you will spend a lot of windshield time or driving between location and location. That's just another part of the job that the team requires of you. So let's talk a little bit about cash. All right, because let's face it, that's one of the reasons you're on this webinar. You want a lucrative career. Okay. And so in our little, what I'll call our pyramid of income here, early in your years, people will not pay you big money until you prove that you can do a job on a consistent basis. But it is fair money on the front side. And this is all in compensation. So what I would call salary plus commission plus any bonus that you could earn as well. So in those first couple of years, maybe upwards of about $95,000, which is still not chump change. But that's about the range that you will be in. And then as you gather and earn more tenure in the industry, right now the 5-year average is about $150,000. So as an individual with your own territory, as opposed to helping support someone else's, you earn your own, you can probably expect to earn in that neighborhood. Then as you, again, gather more experience, okay, in that 6 to 10 year range, now we take another jump up to about $180,000 as, something like an account manager. In this case, you could be managing, you might have a sub rep working with you now. What you started out as, you've grown your business significantly enough that, wow, I need help. Okay. And so you're managing multiple accounts and multiple businesses. And that certainly, because you are paid on your, sales volume, a commission rate probably in the 8 to 10% range, that would pay you a very fair buck. Okay. Then beyond that, we talk about the 11 to 20 year bucket, and you see where it says management. Now we've gone from what I would call individual contributor category to now managing others. All right. This could be a team of sales reps that are peers of yours in a pod structure, or it could simply be as simple as you're a director of sales for, let's say, Georgia and Alabama for Smith and Nephew. And in that case, as a management employee, your income is definitely going to rise. Here you see almost $210,000. Now, there's a lot of responsibility and accountability that's within that. But if you have the desire to perhaps at one point in time run your own sales force, then I think the management pathway is a strong way to go. Pardon me. But again, it takes years of experience to get to that point. And then as you rise in this organization, here you see 20 plus years of experience where you get into director and vice presidential level roles. Now you're at $250,000 and more, depending upon the products that you represent, the performance of your sales team. So the difference is managers are managing reps. Now we're down at the level where directors and vice presidents are managing managers of people. So a second layer of responsibility, and which does allow you to earn significantly more income, much more pressure, much more accountability, but certainly a great opportunity to earn money. Okay. Hopefully that makes sense. And if it doesn't, we can chat about that at the end. So some of the various careers, things that come under this umbrella of medical sales or medical device sales. There are nurses, Now, nurses usually are not in a selling capacity, unless maybe they're a travel nurse where they're selling their services to hospitals. Physical therapist absolutely has to sell his or her services. Forgive my pronouns. Anesthesiologist is the person responsible for getting the patient asleep in the operating room and keeping them asleep. Very, very important role. Occupational therapists, people that get you back to being able to do activities of daily life in the real world, climbing stairs, reaching for things above your head, those types of things. Radiologists, a very specialized area where you can interpret views on radiographs, MRIs, and CT scans. Many surgeons do not consider themselves at the competence level they'd like to be, and they will defer to an actual radiologist for interpretation of things. Surgical assistant, that is the person that most of our graduates, that becomes it's a role in the operating room, and that role is to hand instrumentation off to the surgeon to complete a procedure. That becomes your primary audience. One of your reasons for being in there is to keep that surgeon on time. And a lot of that comes from your relationship and keeping that surgical assistant 2 to 3 steps ahead of what the surgeon is expecting each time they put their hand out. Okay. Obviously, you have the physicians of various specialties that are involved here. Pharmacy tech. I went to a university that had a pharmacy program and a very lucrative career. Most of what we're hearing today is this term med tech. Johnson & Johnson, for instance, just established what they call their med tech division. And so most of things that come under this umbrella is all part of J&J Med Tech.
Scott, I just want to ask if you could clarify for us, and some of it's written down in that bottom section there. If you're in one of these career paths currently, or even something kind of similar to this, some of these even tangential to a medical device rep, how can you transition or kind of leverage your skill sets that you've developed in these roles into that career pivot into hopefully being a device sales rep specifically?
Yeah, I would say on this list, probably the ones that are most likely to transition that we hear from, nurses, certainly. Nurses have really good patient care background. So they're accustomed to being in a care environment, be it hospital, surgery center, nursing home, anything of that nature. So they understand procedures and mostly work with patients on a post-operative nature. Although we do get a lot of nursing that is OR based, that says, you know what, I see that guy coming in here that's wearing the red hat and I really like what he does. He brings value. I think that's something I want to do. Physical therapists and occupational therapists are getting squeezed. They're requiring doctoral level education requirements and capping at around $90,000 a year of income. So we see a lot of people very interested in transitioning out of that into our med device sales sector. And certainly surgical assistants, we love them because they're accustomed to being in that operating room. They understand instrumentation and relationships with surgeons. That's a very strong source for us, if you will. Pharmacy folks tend to have an interest, especially if they're in the sales realm of being in pharma, that the world of med tech and med device has a little more excitement and income potential to them that they're interested in. We do not pull physicians, we do not pull radiologists, and we certainly don't pull anesthesiologists into the sales realm on any. In the time that I've been with the organization, I haven't seen any of those for the most part. Yes, Sue, how can I help? Or do you want to save all questions to the end, Michael?
Participation during is totally fine. Sue, it looks like you raised your hand. So if you got a question, go ahead and unmute, and Scott can address it, or you can alternatively put it in the chat if that's easier. Or if you raised your hand on accident,
Sorry
fine
about
too.
that.
But
I
there you
didn't
go.
mean to
There you
raise my hand.
Okay, no
Okay.
That
problem.
was by
No
No
accident.
worries.
Sorry about that.
No problem.
All right. So how those careers, prepare you for success. We like people that understand anatomy, physiology, and the terminology that we use. And certainly all of those careers bring that to the table. Is it a must? No. Again, I said I'm a business major. I had no exposure to that other than basic biology, if you will. So I'm living proof that any person can learn anything. All right. So have some confidence in that. But that strong foundation helps. All right. And maybe narrows the curve, if you will. But this is a highly technical business. And so the ability to understand highly technical things and process those in a quick amount of time becomes very important. You're making decisions on how to help and go through thought processes during a surgical procedure. You got to be able to think on your feet and process things quickly. I love this next word. It's the one thing that I look from every candidate. I want to see passion, which is when I speak with you, do you make the hair on my arms rise? Because you just can't wait to get into this space. I'm a big proponent of that. And I will tell you, most of the people looking to hire you will be exactly like me. Starts with generic passion, okay? A self-driving motor, but then a passion also for this space and the ability to help people be better, because it's all about the outcome of the patient on the table. We have to get them in and out of that procedure as quickly as we can, okay, and as effectively as we can to get them back to a better life, so that they may be wheeled into that operating room in pain, and they can exit that operating room in less pain, and perhaps as we go down the road, no pain. All right. Your problem solving skills. We talk about having plan A, plan B, plan C in that room. And so you've got to have, if you can't keep it in here, you have your iPad, your iPhone, whatever at your disposal, so that you can quickly reference something and get answers and have the tools available at your fingertips that you need to be able to advise appropriately. So certainly I like science backgrounds, but I also like business backgrounds, because at the end of the day, at some point in time, you're also going to be running a business, which is your territory. I've had every probable major come across my desk in the last 5 years, and we've been able to successfully transition the vast majority of them. Okay, next slide. So in terms so let's get you out of the clinical setting as a preparation. Certainly if you've got sales experience of any kind, and that's a very broad category. I'll tell you, one of the things people like is Cutco knives. You're going door to door getting your head beat in with no's and no's and no's and no's. Okay. But certainly anything that's in sales is something that you would want to highlight. I just mentioned you're going to be running your own business at some point. Having a good finance background will help. Knowing the difference between accounts payable and accounts receivable, and when to expect your commission checks, and how to set back money for taxes if you have a 1099 employment status rather than a W-2 where your taxes are taken out by your employer. Those types of things. So understanding basic business principles. I was a marketing and management major, so I like to think that's fertile ground. Again, getting basics of business, but also understanding from my college days, which was a long time ago. I still remember my first day of Management 101: planning, organizing, leading, controlling. Okay, and those 4 things have been a cornerstone of my professional life. Things that I learned at 18 years of age. And then being a business analyst, well, certainly understanding business trends, perhaps at a pricing level, and how pricing and understanding basic sales price volume analyses, how that can impact what you're doing. Contract pricing lowering, which means you got to sell more product year over year because your price dropped in order to achieve a relatively level income. Why they prepare you? So understanding process, strategic thinking is a big part. And you're going to hear a lot of that, and that's something your hiring managers are going to want to see. We're going to teach you a lot about developing market analytics, analyzing surgeons and facilities and those types of things. Can you have a good relationship building conversation? Do you have what we call relatability, okay, or likability, strong EQ or emotional intelligence? All right. People buy from people they like. They don't buy from people they don't. So that smile is oftentimes your most disarming feature. Use it, okay? And a drive. That's, again, that might as well say grit right there. An entrepreneurial mindset. That meaning you look at alternative ways to grow your business over time, looking at it from different perspectives, for instance. And then the ability to assess, what is it that my customer is looking for or their needs? A lot of this, you will hear the words needs analysis, okay? But understanding what drives them. Is it a financial model? Is it an outcomes model? Is it a purely revenue-based? The more people that come through the facility, the more money we make, and that's what we're all about, but maybe patient care isn't at the top of that list. Those types of things. So a lot of different things that can prepare you for success here. So other areas that we have gotten people, certainly education. So teachers, all right, teachers understand how to relate to people. First and foremost, I'm an educator, okay? Both my parents were teachers, so I'm a strong proponent of this. You can put a sentence together in the right manner with the right grammar and spelling. Oh my goodness. The pronunciation of highly technical terms. There is nothing that will destroy your credibility faster than the inability to do that. So I love education. The hospitality industry, all the time, whether they be part-time jobs or full-time jobs, to try to supplement your career. We love bartenders. We love servers. Bartenders, maybe just a little bit more because they're responsible for a cash drawer and they're really servicing multiple levels of individuals all at the same time. So hospitality is a huge one. Customer service, how to solve problems, strategic thinking, all right? Conflict resolution, you're going to be doing a lot of that. Then engineering and technology, as I think I alluded to earlier, this is a highly technical business. So having an engineering background or a technology background, software, those types of things, tremendously valued. I live with 3 mechanical engineers. So I understand that, and I am not one of them. And so it's a little bit of opposite of me, but boy, do we like that as a background. Nonprofits, nonprofit to me is a little bit of a yin and a yang. Okay, we love that you're working for an industry that at least at the tax basis doesn't earn a profit, but could turn a profit. They just make sure that their expenses equal their revenue at the end of the day. A lot there with relationship building, persuasive speaking, those types of things, which is what sales is. Public service. Had some from political backgrounds. I've had a lot of law students, for instance, that were seeking perhaps or thinking public office, but then pivoted and said, you know, this medical device thing sounds pretty good to me. So there are no careers that in some way don't prepare you in some form or fashion. Okay. Next one. So we get many people that are career change. I would say our new 10-week online program really inspires that because it's evening-based webinars that allow you to maintain your current employment while you go through this process, okay? And that's what that program is mainly targeted to, excuse me. You're going to get technical and clinical knowledge. We use a lot of virtual reality headset activity to teach you what it's like to be in that operating room. Okay. So you get a lot of those experiences. We teach you some sales and business acumen. We're going to tell you how to sell, all right, or at least give you some basic concepts. The organizations that hire you ultimately will also give you sales instruction for how they want you to sell their products within their processes, okay? So I say that medical sales college is foundational learning that prepares you extremely well for the education that you will receive from the companies. Remember, I was a director of sales training, so I saw a lot of MSC grads come into my classes. They always started a little bit higher because of what they brought to the table. All right. And some business acumen. I teach all of my students certain things about preparing for the business, but also problem solving, adaptability, how to react to change. Okay. We'll talk about a competitive nature, but at the end of the day, you got to bring that to the table. I can't make you a competitive person, certainly not over a camera. You have to have some of that basic wiring. Some of the companies have a very common interview question early in their process, and it's simply entitled, are you a love to win or hate to lose kind of person? Black or white? Which one? And that speaks to competitive nature. So prepare yourself from that. I need somebody that I hate to lose. I love to win. Don't get me wrong, but I've always learned more about my losses than in my wins. Okay. This is a secondary one. Leadership. I think you have to bring some of those things to the table. What are some things in your background where you have shown leadership? Okay. Serving on committees. Maybe it's a committee at church or your fraternity at college or in any organization where you're asking for more and ultimately being accountable to more. So, and then you got to have a service mindset. And I think this is more than just med device sales. I think as a good human being, if you have a good servant mindset where you're more concerned maybe about others than you are yourself, that speaks well of you, and people will notice that in you and think very highly of that. Okay, so make sure you're talking about that servant mindset. Okay, next slide. So this is a video. This is a former student of mine. I've had the opportunity to teach at all of our campuses currently, with the exception of Austin, Texas. And so I've kind of traveled the country and had some great students. And this is John Jacinto. I had him in class in San Diego, California. He came into our program as a former police officer, transitioning into a desire to be in medical device. Wasn't sure he could do this. Was a little quiet the first couple of days. I had him for a total of 3 weeks out there, I believe it was. But he knew he had zeroed in on Stryker as a company that he was interested in. And I knew right away, once John kind of came out of his shell, that Stryker was the right place for him. So here's a conversation that he and I got to have. So go ahead and roll tape.
So essentially what led me to MSC and just changing careers altogether, and why I chose medical sales or the medical device industry altogether, was law enforcement was a career that had a lot of, no day was the same, right? No day was the same. And for me, I wanted to choose a career that I would never get bored, right? So, and for me, it's just like, it's constant up and down, right? So like there's days where, like today, I didn't have any cases, right? But next week I have to cover 20, right? So it's just like, there's days where you can relax. And I was doing my research on what was the next career move that I wanted. And for me, I love the aspect that in this, I could still help people out, right? I could still make a difference. I could see people going into the OR that have the hardest time moving, right? And they walk out after the surgery like brand new and they feel like 20 years younger, right? It's an amazing feeling to know that I was a part of that, right? So I guess to take a step back of why I chose to go into this career in MSC altogether, um, was when I was trying to go into this career, like I said, I didn't know any company would take me serious because it's a whole new language, right?
Yes.
I didn't
Yeah.
know, I didn't even know where asparagus was. I didn't know any terminology, right? Like, I mean, my brother told me a little bit about CTs, right? But that's his career,
Yeah.
right? And so for me, it's just like I just felt like it would be a shot in the dark applying with little to no experience other than the fact of, I had working experience, so I could show worth ethic, but I mean, it also I had to bring something that would catch these hiring managers' eye, right? And so for me, that was MSC. So I started to look at like what could I do to have a leg up on these other interviewees, right? And for me, that was going to MSC to be able to learn the base knowledge, to be able to be comfortable with talking to a hiring manager about what their day to day is, right? To be able to step into these interviews and from what I learned at MSC to, talk to them on a normal basis of like, like, oh, I know I have a little working knowledge of what this product does, right? I did some research in the program, right? I was able to, um, basically compare different products, right? And that's something I learned throughout the program and just being able to use what I learned in the interview process and being able to talk to these hiring managers and tell them what with my work ethic from being a cop and my knowledge from MSC, why I would be an asset to your team.
I love that video. Okay. John, I watched his confidence grow throughout the 3 weeks that I got to have with him. And then I ultimately also got to go back and graduate that crew in San Diego. So I spent, I think, 5 of their 12 weeks with them. They had a very tight-knit class. John eventually was the most valuable participant in his class and kind of came from behind to do that. But he's an outstanding young man that as an associate Mako product specialist. So Mako is that you see at the top of that slide, it is a surgical robot. And Stryker was the first company to introduce that kind of technology into the orthopedic space. Intuitive Surgical and the Da Vinci robot were the first ones, but that was more within the abdominal cavity. This was developed for work in joint applications, hip, knee, and now shoulder. And they'll probably be in the ankle soon, I would think. But he targeted that. He worked it, and he got exactly what he wanted. And like he said, he wasn't sure that law enforcement was going to get anybody to really take him seriously. And you combined that with the MSC experience, and that was a winning combination for him. He's an outstanding young man.
So essentially, what led me to MSC?
So, what are some of the things? How do we bridge the gap of your transition from what maybe you're currently doing to what you want to be doing in this particular space? So yes, we're going to give you some sales fundamentals. We've developed our own internal process there. It's very generic. If you get into the industry, you'll find, and it's not specific to med device, there are 3 primary books on selling that are out that are used by organizations. One is called Spin Selling. Number 2 is Integrity Selling. And number 3 is called the Challenger Method. All right. And we chose not to use any of those 3 because 66% of the time we're probably going to be wrong. And so we felt like it was more important to give you some fundamentals on selling as opposed to formal process, because you're going to get that from the company that hires you. Okay. A little bit on negotiation and closing. We don't spend a ton of time on this, more than we used to, because early in your career, you're more of a servant and performing service level functions than developing functions. Okay, that kind of comes later on as you have your own territory, but we give you some basic fundamentals on that. How pricing is established, how you get products into a hospital, things of that nature. A little bit on territory management. How do you analyze a territory? And a territory could be, as for you, as small as one hospital, or a series of hospitals, or a county, a zip code, a state, multi-state, types of things. Depending upon the role that you take on, your geography could grow, but how to analyze it and kind of run that territory. And to understand, there is a business side of healthcare. It's not just procedures. It is costs of procedures and how to save hospitals money with technology, for instance. That robot that I just talked to that John is involved in, they're still evaluating. Everybody is in agreement that the robot has a more finite capability to deliver results in terms of better results. But it still takes longer than manual instruments. And until it can get to that point where it's saving time in addition to improving outcomes, it's going to be a little bit on the fence of acceptance, especially at $1 million a pop. Okay. But there's a business side to healthcare and understanding infection. And if you have to come back to the hospital for any reason in the first 90 days, that the hospital is on the hook for your care, those types of things. So there is truly a business side that we'll talk about. And then we talk about real world applications. We're going to get your hands dirty. And that's the best part of this. The online case comes to Atlanta for week 10, your last week, and we get your hands dirty and do all the procedures. If you're in the classroom for the 10-week experience, then you're getting it starting in week 4. Weeks 4 through 9 are all some form of hands-on. And so we're going to get your hands dirty. And for instance, I would be one of those people teaching you how to do total knee arthroplasty, which is the #1 surgical procedure that we're doing right now that drives the business. Okay. So we give you real world stuff with actual instrumentation they're using, as you can see here. All right. We're going to teach you that anatomy and vocabulary. John referenced it, an entirely new language. My brain, I am not a bilingual individual. Okay. I can understand basic concepts of French, Spanish, Italian, and German. Okay. Enough to read a menu and get myself fed. But I do tell people I'm bilingual because I speak orthopedics fluently. Okay. And that is a learned language and has a lot of pronunciation issues. And as I alluded to earlier, you got to be able to do that. So we're going to teach you a lot about the body. Okay. What that anatomy is. You have to understand the anatomy to then determine what the appropriate fix is. All right. Product and procedures. So probably the lead off here is knee replacement and hip replacement and trauma. Those are and spine are really, really big, along with sports medicine. Those areas are the majority from a procedural knowledge that we'll teach you, but you, as she is showing, she's doing doing something with a total knee there for that photo. We're going to get your hands dirty and let you do that. All of these products have certain regulatory aspects to them. They've been approved for permanent implantation, for instance, by the FDA, or the Food and Drug Administration. Learning how that works, what those requirements are, and then compliance, how to legally interact with healthcare professionals. This business changed a great deal in 2008. 13 years ago in August, as to how you do compliance and the reporting of your interactions, especially when it involves the spending of money, okay, and reporting those things, something called the Sunshine Act. And yeah, you are going to spend an inordinate amount of time in front of really, really smart people, Okay. And so we're going to teach you how to do that and how to have those conversations, but we'll crawl, then we'll walk, then we'll run as we teach you that. And hands-on and case studies. So case studies and clinical articles are the way that surgeons communicate with other surgeons, okay? Speaking that orthopedics language. We're going to teach you how to dissect those, to comprehend, understand, and then speak about them to them. And that's certainly a skill that has to be taught. But those are probably the 5 big things that we're going to teach you. Next slide. Lots of companies in this space, okay? And here are what you see represented on this screen are the ones that probably hire the most medical sales college graduates. And it starts with that big, bold name in the center there called Stryker. Stryker is the largest company in orthopedics. They are a burgeoning $30 billion organization. And so they hire the most MSC grads of any company there. I believe it's Stryker, DePuy Synthes, Zimmer Biomet, Smith & Nephew, and probably Arthrex right now that hire the most of our grads. And then some of the other companies, ConMed has been very supportive of us, Medtronic, Boston Scientific. You see J&J MedTech there. Actually, DePuy Synthes would fall under J&J MedTech now as part of that organization. Paragon 28, a foot and ankle organization, has been purchased by Zimmer Biomet in the last month or two. So there was a lot of value placed in extremities, distal extremities, hand and wrist, foot and ankle is actually the fastest growing sector. So this is just a small list of the top hiring companies. And I have graduates that go into women's health care, men's health care, prostate care, women's breast health with a company called Hologic, does wonderful things for the human body in helping women. So there are a lot of different things that you can branch out into. This does not mean when you go through this, when we're teaching primarily about the orthopedic space, that you are bound into the orthopedic space. Boston Scientific and Medtronic are the two of the larger cardiac care companies, okay? So that's certainly out there. Neurosurgery, just a little bit of everything that we prepare you for. So I tell every student, it's not about what you know that you've been taught. It's about who you are in your chest. Can you prove to someone that you have all the attributes that they want in a new sales rep? They kind of assume you don't know that much and they're going to have to teach you everything. That's okay. We want to under-promise and over-deliver in that, okay? But it's not what you know, but who you are that's really going to make the difference. So let's get to some important Q&A. So what kind of questions? Have I generated anything worthy of a question? Hopefully I have. Do we have anything in the chat, Michael?
Nothing in the chat yet. Looks like Johan has his hand raised. So if you want to unmute, happy to answer your question.
All right, yeah, thank you for this. I have a couple of questions. I come from a business development background in medtech, in a new product development and so forth. But the question I have is, I still trying to grasp what a sale looks like in this industry. What would be what would consider I sold somebody something at this point? Because I'm not sure how you get to a doctor behind closed doors.
Okay, so I'm going to give you my favorite answer that my students hate, and that's called it depends, all right? Because if you're selling, for instance, I'm kind of looking on my desk here to see if I have anything. If you're selling drapes to an operating room or something that generic, that's probably being sold at a national level, and you're representing it on a local level. But if you're selling an implant, okay, yes, Your job, Johan, is to get behind that that desk and beyond that office administrator, whose job is to not let you in. Oh, by the way. So you've got to demonstrate value. I like to put it this way. The more expensive the device you're selling, the longer the sales cycle to make the sale. And oftentimes in a hospital environment, you have to be approved to use a product in a hospital. And that's something we teach you called the Value Analysis Committee. So there's department heads of the major operations of the hospital that meet, and then you have to make a presentation, or you make your pitch, or someone has to make that pitch on your behalf, as in a healthcare practitioner, to get that product approved for use. So the sale takes on many different vantage points. What we see from our graduates is early on in your career, you're not selling because the sale has already been made. You are servicing that sale, as in being in on procedures. Does that make sense?
Yeah. So what would make you a successful hire in the first 90 days?
Okay. I'm going to go back to the attributes. All right. Will you show up on time every day and do exactly what you're tasked with every day with a smile on your face? Okay. They're looking for that grit, that hustle, that determination, that accountability, responsibility, stick-to-itiveness that differentiates you from the other people that they talk to. You have to make someone believe in you at a personal level before they'll invest in you at a, call it a product level. Does that make sense?
Yeah. So there's not a materialistic guideline that you have to sell so much in the first 90 days. And then my last question is something else. I was just wondering about the gore. If you're not used to being in a surgery room and you see the blood for the first time,
yes,
do you get used to that?
Absolutely. At least okay. I did. It is, I say you have to get used to a couple of different smells. Most of those are either burning flesh from electric cautery, which they'll use an electric current to cut skin and tissue, all right, to open up a surgical wound. That's one. And the other is what I call is bone cement, or a kind of a bone glue that they use to get implants to hold in place. For the ladies on the call, you'll understand if I say it smells like the nail salon. Okay, just give me a thumbs up there if you know what that is, or gentlemen, if you've had a mani-pedi kind of thing, that smell. Okay, that's really what it comes down to. But more than likely that we're going to know, because they're going to get you into those. So if you observe it, surgical videos, for instance, if you want to know about that, Johan, there are a lot of sites out there to go to watch surgical videos. And I advise everybody, watch as many total knee arthroplasty and total hip arthroplasty procedures. Do that search, watch those YouTube videos. That'll give you a sense of what you're looking at. Okay. In all my years, I only saw one person faint. Okay. And it's actually maybe a little badge of courage too, that there is an understanding. But we're going to want to know those things on the front side. If you are sensitive to the sight of blood on a cut on your finger, a surgical roll may not be for you.
Thank you.
Absolutely. Absolutely.
Johan, excellent questions. Thank you so much.
Yes.
I think I see Sue's hand is raised.
Yes. Sue.
Hi there. Thanks for the presentation, by the way. I have a question. I'm actually Canadian, and I'm calling from Canada. I know that I've called about the program, but it's not really held for Canadians right now.
Yes.
But I had a question because Alberta, where I live, is starting to pivot towards privatization of hospitals.
Okay.
So that's why I thought I was kind of interested in this. And plus having family members that are in the medical field, I was really looking at this, and I'm kind of a little bit bored of my career right now. I'm from oil and gas, as most Albertans are. And so I thought I'd look into something a little bit different and pivot in a different direction.
Yeah.
Sales is actually very interesting for me. I've had to do sales for a very long time anyway. So I'm just wondering how Canadians would be able to access your program, if
So
possible, in the future. Mhm,
yeah. So perhaps the online option would be your best one. Okay.
mhm, mhm.
Because as long as you've got a Wi-Fi connection, okay, you can access the content and participate. Okay.
Mhm.
And then it would require a 1 week, really a Sunday to Friday experience in Atlanta, Georgia.
Yeah. See, and there's no issue with that. But
Yeah.
when I did call in, I wasn't given that option.
So
Mhm.
that is also a relatively new piece of the curriculum. All right.
Okay. Okay. Yeah.
So and one of the reasons we developed it was for people like yourself that are looking at career change. Okay.
Mhm.
Not the what I'll call the burgeoning 20 somethings that are just graduating from college that are looking at, okay, they're used to being in a seat in a classroom. And
Yeah.
so the natural transition is into another classroom experience.
Mhm.
Those that are full-time employees, this gives them the option to get the same relative level of experience or exposure, and then get them all the hands-on that the live class gets the last week of the program.
Mhm.
I think that's the true benefit. We
Okay.
were seeing call it a gap in our services, and I
Mhm.
think we pretty well filled that gap now.
Okay. Yeah, because I think even those companies that you showed, they're pretty much everywhere. They're not just in the US, they're in Canada and elsewhere. So I think if we had that opportunity, that's great. So that's good to hear. Thank you very much.
This is Michael Moses. I'm VP of Marketing here. We'll be sure. I know you have a career advisor. They'll follow up with you on the specifics, but beyond the career changer student, one of the reasons we've created Total Ortho is for those who are in the Americas, maybe outside of the US as well as Europe. So it's new for us, but it is really an evolution of the curriculum that we've proven to work with our on-campus model.
Yeah.
But redeveloped and designed with the latest and greatest in instructional design methodologies, as well as virtual reality, where you're with your classmates in a virtual setting. And it's certainly something that is available to you being in Alberta. So great question. And we'll follow up with you. Your career advisor will follow up with you on that program.
Oh, excellent. Thank you very much.
Sure.
You're very welcome.
Thank you.
And Sue, just so you know, my boss in the organization until recently is a Canadian who was general manager for ConMed Canada at one point in time. So I've done a lot of business in Toronto over the years, as well
nice.
as out in Vancouver. So
Well, I think that there's a lot of untouched opportunity here.
Yes.
That still is out there to explore. So that's why I thought I would look into your course and see what you guys had to offer. So I'm excited to hear more.
So I for instance, back in my Zimmer days, I can think of a gentleman, Haven Mason, was a product manager for Zimmer Canada, as a Toronto guy that actually made a career pivot and moved to the US to be a salesperson in Omaha, Nebraska.
Oh, interesting.
And it was a very successful transition.
Well, that's funny because we're used to moving to the US for oil and gas, but now that would be a good opportunity as well. So great to hear that. Thank you very much.
No problem. No problem. Anybody else?
Well, if nobody's going to have something else, one more question.
Sure. Go ahead, y'all.
Yeah, I'm just curious. Like you said in the first, I'm just saying when you start and you're working under another rep, and our income is based on commission and some form of structure of a salary, I assume. But if you're just going out there and smiling, if you want to put it that way, how do you generate commission from that period?
Well, the commission at that point in time is paid directly to the senior rep that you work underneath, and then there's normally a trickle down of that into your pocket from an incentive standpoint. So they would probably set goals for their team, for instance. You meet the goals, then that's when your incentive compensation comes into play. They're doing all the selling. You are doing the servicing, let's just say. So let's just say, for instance, I'm going to try to give you a good analogy to the gentleman that showed up here and sold me my new gutters for my house. Okay. He had a team of people working underneath him that I had conversations with both of them, but there was no doubt who the lead guy was. And he's the one that negotiated the deal, made the sale. And then it was the junior person that showed up to handle the installation. Okay. That's kind of a little bit like what's going on here. All right. In most cases, your job exists or is posted as a need by the company because somebody has grown their business beyond their ability to service it solo, and they need help. And so part of the interview process, in my humble estimation, is selling yourself as a solution to that. You have a need. I'm here to tell you why I'm the solution to your need.
And Scott, could you briefly talk about that transition from being, and it's natural when you start out, you're proving your trustworthiness both with the healthcare practitioners as well as your new company. But can you just briefly talk about how that transition can happen from being primarily servicing the account to now having a book of business of your own and building that trust?
All right. So, Johan, where are you from, sir, in the U.S.? Where are you living right now? That might help me.
In Houston, Texas.
All right. You're in Houston, Texas. Okay. The Med Center downtown in Houston is what, about 27 hospitals, something like that? Okay.
It's huge. Yes, that's correct.
Yes. All right. And so the natural progression, because of the nature of Houston, all right, is you would have a rep that's, say, working for ConMed and doing sports medicine, knee scopes, ACL repairs, rotator cuff repairs in the shoulder. And he's got two surgeons, and those two surgeons keep him hopping. But then all of a sudden, this third surgeon that he's been talking to at a different hospital says, you know what? I want to try your stuff. Okay. And now you've gone from two surgeons at one hospital, let's just say, to three surgeons at two hospitals. Now we can't be in two places at one time. And I've got my two surgeons here that are kind of on autopilot. But over here, say at Methodist, I need to spend some time and get them up to speed. So I need help. So Johan is available to me. He convinces me that he's the right guy, the solution to my needs. I'm going to take Johan and I'm going to put him in the OR with my two surgeons that are used to using my products. All right. He's going to be an extension of me. All right. In that room. And then I'm going to spend most of my time over here at Methodist getting them up to speed. And then maybe there's a second surgeon at Methodist, or maybe then St. Joe's across town has an opportunity for him. So the business grows exponentially after the result of your hiring. Companies don't like to have reps having too large of a territory. So then they would perhaps carve off those original two surgeons, and now that becomes your quota-based territory. And now you own those surgeons and that business. And then your role over time is to grow it perhaps beyond your ability to service it and hire a sub rep for you. And the process repeats and repeats. Does that make sense?
Yeah, I understand that. But isn't it kind of a risk from the rep that now I could lose these two doctors because I'm introducing them to somebody new? I mean, that's a big stream of income that he's putting out there, basically. A risk for your steel, if you want to call it that way.
So don't you think that senior rep is going to sit those doctors down and talk about that on the front side? Okay. And so
Okay.
it's not that I'm not abandoning you. I'm still at your quote unquote beck and call, but you know this business, you know these products, but I know you want somebody in the room. And I'm convincing you that this person is an extension of me. So it goes back to the relationship selling aspect of, you guys know my role as a salesperson is to expand my business, but I don't want to abandon you. So I'm going to put somebody in here that I completely trust. And if there are any issues, you reach out to me. But all of those conversations kind of have to be had on the front side.
Okay, thank you.
Sure. What else? Was that what you wanted, Michael? Is that sufficient?
So great, yeah, and we're over time, so I want to thank everyone who attended for staying on and going over and participating in that really great engagement. Thank you for the discussion and the questions. I did notice a few folks joined just a few moments ago, which is great. We have recorded this session and we'll be sending it out via email as a follow-up, so you'll be able to view it and hear everything that Scott went over in the deck, as well as the great conversation we had to close. We'd like to, again, thank you all for your time. Scott, thank you so much for walking us through that and what a career change or career pivot could look like. On the screen there, you'll see a QR code that goes to the application. If you've not already applied, we encourage you to do so. And have the opportunity to meet with one of our evaluators, where you can have a more in-depth one-on-one conversation about your fit for both the career path and for medical sales college. Of course, follow us on our socials. If you'd rather give us a call, pick up the phone, give us a ring. The number's right there on the screen. Happy to chat with you then.
Point of clarification, Michael.
Yep.
Just to understand, folks, by clicking that apply, that simply gets you more information. There is no commitment that's involved in clicking on apply.
There is zero application fee.
Yep.
It just allows us to understand your interest, a little bit about your background, potentially what program or what cities you're curious about potentially attending, which just allows us to have a more tailored conversation to what you need. So great point, Scott. Yes, it is not a very long application. Shouldn't take you too long a time, and zero application fee. All right. Well, thank you all very much for attending. Check your inboxes for follow-up. Scott, thank you as well. And we will talk to you all in the near future.
My pleasure.
Thank
Have
you
a
very
great day, everybody.
Thank you.
Thank you very much.